Bismillahirrahmanirrahim. Today we are studying signaling pathways and mechanisms for autonomic receptors. Autonomic receptors are adrenergic and cholinergic. Adrenergic receptors are alpha 1, alpha 2, beta 1, beta 2. Cholinergic receptors are nicotinic receptor NM or N1, NN or N2, M1, M2, M3. Now, alpha 1 receptors are present in smooth muscle, and there is IP3 calcium mechanism, while alpha 2 receptors are present in the gastrointestinal tract, and there is cyclic AMP mechanism. Beta 1 receptors are present in heart, beta 2 in the smooth muscle, and similarly cyclic AMP mechanism in both. Cholinergic receptors are present in NM, nicotinic receptor, present in skeletal muscle, NN in the autonomic ganglia. M2 receptors are present in heart, and M3 receptors glands and smooth muscle. Now we come to the receptor types in the ANS. As described above, adrenergic receptors, adrenoreceptors are present. Alpha 1 receptors, alpha 2 receptors, beta 1 receptors, beta 2 receptors. Now we start with the alpha 1 receptors. They are located on vascular smooth muscle, muscle of the skin, and splanchnic regions, the GI and bladder sphincters, and radial muscle of the iris. Alpha 1 receptors. They produce excitation, contraction, or constriction. Are equally sensitive to norepinephrine and epinephrine. However, only norepinephrine released from adrenergic neurons is present in high enough concentrations to activate alpha 1 receptors. Mechanism of action as described above is stimulation of phospholipase C and increase in inositol 1,4,5 triphosphate, IP3 and intracellular calcium. In short, we will say that alpha 1 receptors are present in smooth muscle of skin and splanchnic regions, bladder and GI sphincters, and radial muscle of the iris, and there is excitation or contraction or constriction by alpha 1 receptors. Alpha 2 receptors are located on the sympathetic postganglionic nerve terminals, autoreceptors. There is inhibition, relaxation or dilatation, while mechanism of action is inhibition of adenylate cyclase and decrease in cyclic AMP mechanism. Beta 1 receptors are present in SA node, atrioventricular node, ventricular muscle of the heart. Prominent receptor in the heart is beta 1 receptor. There is excitation or increased heart rate, increased conduction velocity, increased contractility. They are sensitive to both norepinephrine and epinephrine and are more sensitive than alpha 1 receptors. Mechanism of action is stimulation of adenylate cyclase and increase in cyclic AMP. Beta 2 receptors are located on vascular smooth muscle or skeletal muscle, on bronchial smooth muscle, and in the walls of GI tract and bladder. They produce relaxation, dilatation of vascular smooth muscle, dilatation of bronchioles, relaxation of bladder wall. Are more sensitive to epinephrine than to norepinephrine. Beta 2 receptors are more sensitive to epinephrine than to norepinephrine. Are more sensitive to epinephrine than the alpha 1 receptors. Mechanism of action is increase in cyclic AMP mechanism. Here we end with the adrenergic receptors. Now we come to the cholinergic receptors. Cholinergic receptors are nicotinic and muscarinic receptors. Nicotinic receptors are located in autonomic ganglia of the sympathetic and parasympathetic nervous system at the neuromuscular junction and in the adrenal medulla. The receptors at these locations are similar but not identical. Nicotinic receptors are blocked by ganglion blockers hexamethonium in the autonomic ganglia but not at the neuromuscular junction. Mechanism of action is acetylcholine binds to alpha subunits of nicotinic acetylcholine receptor. The nicotinic acetylcholine receptors are also ion channels for sodium and potassium. Now we come to the muscarinic receptor. Muscarinic are located in heart, smooth muscle and glands. M2 receptors in heart, M3 receptors in smooth muscle and M3 receptors in the glands. They are excitatory in smooth muscle and glands. They are activated by acetylcholine and muscarine are blocked by atropine. In this section of this chapter, nicotinic receptors, we studied that hexamethonium is ganglion blocker in the autonomic ganglia but not at the neuromuscular junction, and muscarinic receptors are blocked by atropine. Mechanism of action of muscarinic receptors is inhibition of adenylate cyclase, which leads to opening of potassium channels, slowing of rate of spontaneous phase 4 depolarization and decreased heart rate. Because muscarinic receptors are inhibitory, so they are decreasing the heart rate, and atropine is blocking this action, so increasing the heart rate. Smooth muscle and glands, stimulation of phospholipase C and increase in IP3 and intracellular calcium. Now we come to the section of drugs that act on the autonomic nervous system. At alpha 1 receptors, norepinephrine is the agonist and phenoxybenzamine is antagonist. At alpha 2 receptors, clonidine is the agonist while zohimbine is the antagonist. At beta 1 receptors, norepinephrine is the agonist, propranolol is the antagonist. Beta 2 receptors, isoproterenol is the agonist while propranolol is the antagonist. At nicotinic receptors, acetylcholine is the agonist while curare neuromuscular junction N1 receptors is the antagonist. And also hexamethonium ganglion N2 receptors is the antagonist of nicotinic receptors. At muscarinic receptors, acetylcholine is the agonist while atropine is the antagonist. And now we end with the drugs of autonomic system.